The final part of the dissection will be directed towards the brainstem and the cerebellum. And just for your orientation here again, here is the brainstem, the mesencephalon, pons, medulla oblongata, and this very typical tent-shaped fourth ventricle here. Look, this is the very thin anterior medullary velum here, and this then the cerebellum with a typical arbor vitae. As you can see. This is part of the tonsil in the back here. And if we flip the brain, the piece around like this, here again we will identify a few structures. Start from this part here. Here is the trochlear nerve, as you know, coming out here on the dorsal surface of the brainstem, just behind the inferior colliculus that is located here. Trochlear nerve. This is the trigeminal nerve, and if we go a little bit further down here, here is the abducens, here is the facial nerve, and the large one here is the vestibular cochlear nerve. And here you can see the flocculus, this part of cerebellum. What we'll do, we'll clean the preparation a little bit. We'll take away here the artery, the superior cerebellar artery here, and take away the pia a little bit on the dorsal surface, the superior surface, like this. Then we will turn to the anterior inferior cerebellar artery, take that away, clean up a little bit, like this, and then finally down here between the brainstem, here's the olive, as you can see, here's the pyramid, here is the pica, posterior inferior cerebellar artery. We strip it off from the inferior surface of the cerebellum. And when we have done that, we have prepared ourselves rather nicely for the dissection of the cerebellar peduncles. Well, to be able to dissect the cerebellar peduncles now, we have to remove the lobules of the cerebellum. So look at this. We just strip it away like this. Here and here it goes. Here on the medial side. The vermis. Now I am working on the vermis here, as you can see. Taking that away. Here comes the rest of the cerebellar lobules here. And we clean it up, so we simply will end up with the central white substance more or less here, the core of the cerebellum like this. And now what we will do here, again for orientation, I will take away also the flocculus here. There we go, like this. Now we have cleaned it rather nicely. Now we clean a little bit on the, take away the nerves there, and here clean it up a little bit. And as you know, there are three pairs of cerebellar peduncles. Here is one. This is the inferior cerebellar peduncle, which carries a lot of information from the spinal cord up towards the cerebellum. Then, of course, you have the middle cerebellar peduncle here, primarily fibers, or practically completely fibers from the nuclei in the pons, located here in the base of the pons, going up towards the cerebellar cortex, the so-called pontocerebellar system. And then you have the superior cerebellar peduncle, that is this peduncle here, which carries information primarily from the intracerebellar nuclei up here towards the red nucleus and the thalamus, but also fibers to the brainstem, reticular formation in this region. Now, the first thing that we will do is turn our attention here to the vestibular cochlear nerve. We'll strip it up like this, so we can see a little bit better the inferior cerebellar peduncle. Now I strip it away, and with it goes also the cochlear nuclei there. Now what we'll do, we will push a probe here on the lateral side, as you can see, of the inferior cerebellar peduncle, and we will push it forward and up towards here. You can see it's coming out between here, the middle cerebellar peduncle here and the superior cerebellar peduncle. Then what we will do is cut through the fibers here of the middle cerebellar peduncle like this, and then strip up these fibers like this. The fibers of the middle cerebellar peduncle coming up like this. Now we have removed the fibers going up here through the middle cerebellar peduncle. Well, the next thing to do is push the probe here on the medial side of the inferior cerebellar peduncle. Again, push it forward, but push it again towards the lateral surface here of the superior cerebellar peduncle. And then if we cut through, these fibers will be about like this. We can then strip away the inferior cerebellar peduncle fibers coming up here towards the cerebellum, something like this. Here we have taken away the fibers coming via the inferior cerebellar peduncle. So here is the cut surface of the inferior cerebellar peduncle here. Look. Well, what we have left now is simply the pedal here and the superior cerebellar peduncle. So if we take a hold in the pedal and lift the superior cerebellar peduncle from its bed like this, you can see how the superior cerebellar peduncle is disappearing into the structure of the mesencephalon. Actually, it will come out at about this level in the decussation of the superior cerebellar peduncles. If we cut a section a little bit further down, you'll see this white area coming up here. That's the superior cerebellar peduncle. Let's cut even a little further and see. This is the decussation of the superior cerebellar peduncle. See, if we dissect it free here, that's where the fiber will end up, as you can see here. Well, what do we have in the pedal? Well, what we should have would be most of the intracerebellar nuclei. And as you know, the real large intracerebellar nucleus is the dentate nucleus. So let's cut here and see if that's what we come up with. Look, here it is, this bag-shaped nucleus, the dentate nucleus, the largest of the intracerebellar nuclei. Here is the full cerebellum brainstem preparation. And we'll remove now the cerebellum here from the brainstem. And then we will get a very nice preparation where we can look at the rhomboid fossa, which is the floor of the fourth ventricle. Well, to remove the cerebellum, what we have to do is to cut through the three pairs of cerebellar peduncles, the inferior cerebellar peduncle, the middle cerebellar peduncle, and here, rostrally, the superior cerebellar peduncle. So we'll take the scalpel and we'll cut here through the middle cerebellar peduncle, go rather high up underneath the cortex here of cerebellum, and cut a cross-section towards here the region of the flocculus that is lying here. Here is the vestibulocochlear nerve, as you can see, and here, as you remember, is part of the choral plexus coming out through the lateral aperture. Well, what we will do now is to cut the section just about like this, cut through the middle cerebellar peduncle. Then we'll turn it around and look for the inferior cerebellar peduncle that is here. We'll continue the cut through the inferior cerebellar peduncle. Then we'll turn around like this and cut through the superior cerebellar peduncle, which is located here. Then we'll do the same thing on the other side. The preparation here is the flocculus here, and we'll make a cut towards this region here. Here we cut through that middle cerebellar peduncle, and here the inferior